Welcome to this explainer. Today, we're tackling something deeply personal and honestly, scientifically mind-blowing. IVF. We're drawing entirely on the Mayo Clinic's comprehensive guide on in vitro fertilization to really break down this multi-step journey. So whether you're navigating this yourself, supporting a loved one, or if you're just curious about the sheer science of assisted reproduction, you are definitely in the right place. Let's get into it.
Okay, let's just jump right into our agenda. We're going to follow the exact path a patient takes. First up, what is IVF? Then, preparing for the journey, retrieving eggs and sperm, fertilization in the lab, the embryo transfer, and finally, understanding your results.
So, let's start with section 1. What is IVF? Understanding the foundation. Right off the bat, we need to clear up a common misconception. IVF isn't just one quick surgery or a simple pill. It's actually a highly coordinated, complex series of procedures. It's literally the cornerstone of assisted reproductive technology. And the whole idea? You're taking mature human eggs and sperm, handling them completely outside the body, and then carefully returning a fertilized embryo to the uterus to develop. It's a huge undertaking. Now, you might be wondering, why do people go through all of this? Well, it's for a whole host of reasons. We're talking mechanical blockages like fallopian tube damage, conditions like endometriosis, or even to avoid passing down genetic disorders. Plus, it's a total game changer for preserving fertility, like if someone needs to freeze their eggs before going through something incredibly harsh, like cancer treatment. Moving on to section 2, preparing for the journey, screenings and stakes. You know, before the active cycle even kicks off, the medical team essentially has to map out the body. They run all these baseline tests, like checking the ovarian reserve to see the egg supply and doing really detailed uterine exams. They do this to predict exactly how a patient's ovaries will respond to the medications. Get this, they even do a practice embryo transfer. It's basically a dry run so the doctor can map the exact depth of the uterus and figure out the absolute best technique for the real deal. But let's be real for a second. We have to acknowledge the stakes here. The Mayo Clinic makes it very clear that IVF can be incredibly draining, physically, mentally, and, yeah, financially too. There are real medical risks involved. Take ovarian hyperstimulation syndrome, or OHSS. That's when fertility drugs actually cause the ovaries to become painfully swollen. Then there's the chance of multiple pregnancies, or an ectopic pregnancy where the embryo attaches in the wrong spot outside the uterus. And here's a stat that really puts things into perspective. When using fresh embryos, the rate of miscarriage is kind of similar to natural conception. But maternal age is a massive factor. For someone in their 20s, the risk is about 15%, but if a patient is in their 40s, that risk skyrockets to over 50%. It just goes to show how profound age is in this whole equation. All this prep brings us to a super heavy moment of patient agency. Before a single embryo is even created, folks have to make some major ethical and medical choices. You have to ask yourself, how many embryos are we transferring at once? And what on earth do we do with any extras? Freeze them? Donate them? Discard them? These are massive, life-altering decisions made before the physical cycle even starts. Okay, section 3, retrieving eggs and sperm. The medical cycle begins. To really ground ourselves in what this looks like day to day, a full cycle of IVF takes about 2 to 3 weeks of carefully timed clinical steps. We're talking 1 to 2 weeks of hormone stimulation, followed immediately by the egg retrieval. Then an embryo transfer just days later, and finally, a wait of 12+ days for a blood test. It is a very tightly packed, intense window. Let's break down that very first step. Normally, a body develops just one single egg a month, right? Well, with IVF, the goal is to completely override that natural cycle using lab-made hormone shots. The doctors want the ovaries to produce multiple eggs simultaneously, so they meticulously track follicle growth with ultrasounds and blood tests, delay natural ovulation with more meds, and then, boom, they give one final trigger shot to mature those eggs at the exact right second. Then, exactly 34 to 36 hours after that final shot, it's retrieval time. The standard method here is called transvaginal ultrasound aspiration. Basically, while the patient is under sedation, an ultrasound guides a really thin needle to the ovarian follicles to gently suction out the eggs. The whole thing takes maybe 20 minutes. And fun fact, on that exact same morning, the sperm sample is usually collected and prepped in the clinic too. All right, section 4, fertilization in the lab. Science meets biology. This is where science quite literally meets biology. We follow the retrieved eggs and sperm right into the laboratory. Now, the lab usually goes with one of two distinct techniques. First, there's conventional insemination. That's where healthy sperm and mature eggs are basically just mixed together in a controlled incubator to do their thing naturally. But if there are issues with semen quality, they bring out the big guns. Intracytoplasmic sperm injection, or ICSI. This is wild. A specialist literally injects one single healthy sperm directly into a mature egg. No way around it. That's just incredible science.
So, if fertilization works, the waiting game begins in the incubator. 3 days in, a healthy embryo is just about 6 to 10 cells. But by the 5th or 6th day, it transforms into what's known as a blastocyst. Think of it as a rapidly dividing ball of cells. The inner group is going to become the embryo itself, and the outer group becomes the cells that protect and nourish it. Once it reaches this blastocyst stage, it's primed and ready for the next phase.
Which brings us to Section 5, the embryo transfer, returning to the body.
This is essentially the climax of the IVF journey, taking all that incredible science and putting it back into the human body. Usually about 2 to 6 days after the egg collection, the patient heads back to the clinic. And compared to the retrieval, this part is surprisingly simple and usually totally painless. The doctor places a long, thin, flexible tube called a catheter right through the cervix. A syringe containing the embryo is attached, and it is just carefully pushed into the uterus. And then, you hope it successfully attaches to the lining. And that leads us right into Section 6, understanding your results. The final wait. 12 days. That is the agonizing minimum number of days a patient literally just has to wait after the egg retrieval before they can take a reliable blood test. Can you imagine? You're just going about your daily routine, maybe dealing with some bloating or cramping from the meds, desperately waiting to find out if the embryo implanted. It's often described as the single most psychologically demanding part of the whole shebang. Now, if that 12-day test comes back positive, fantastic. The patient gets referred to a pregnancy specialist for prenatal care. But if it's not positive, the care team has to step back and evaluate what happened to figure out the next move. They look at all sorts of factors: maternal age, how well the embryo's developed, and even lifestyle factors like smoking or obesity. It's all about adjusting the protocol for a potential next cycle. It's this ongoing process of, really, scientific refinement. So we're going to leave you with this final thought. Think about everything we just covered: the intense physical preparation, the profound ethical choices, and the absolute microscopic precision going on in the lab. Knowing all of this, how does understanding the reality of this grueling 3-week medical journey change the way you view assisted reproduction? It really highlights just how intricate, challenging, and honestly, scientifically miraculous the process of building a family through IVF truly is. Thanks for joining us for this explainer.